Greetings and thanks for tuning in today. My name is Dr. Jeanette DeWitt. I am a doctor of physical therapy and a chronic pain specialist, and I have a question for you. Are you being treated for your pain, or are you being treated for your problem? There is a big difference, and I will tell you that when I had my traditional physical therapy practice, people did not come to me for pain. And you might be thinking, what? People who go to physical therapy for pain. No, most people will live with some amount of pain. People who wake up in the morning and they feel kind of achy and they walk it off, they don't come to physical therapy because they have pain in the morning. They come to physical therapy or seek other alternatives when that pain prevents them from doing what they want to do. Let's just clarify something. Okay, if we have a scale of 0 to 100, the only way anybody who I talk to, whether they're a client of mine now for medical massage or personal training, or whether I'm doing virtual coaching with some wellness programs, if their pain, if they say they have pain at 100, and they did not go to the urgent care or the ER, they don't have pain at 100. They can say it's 99, but they cannot say it's 100 because they did not go to the ER or the urgent care. If they say they have 0 pain, that means they have no problem at all. This is my fitness client. These are my personal training clients. They don't have pain, but they might have soreness, or they might have lack of mobility, or they might have less strength than they would like. So then we change that scale from a pain scale, and I say, how weak do you think you are? And they say, oh, I feel like I'm about 70%. All right, so their 70% is like my pain person who has a 70. It's definitely noticeable. It's changing how they do things, or they can't do what they want to be able to do. So when people come to me, I can't just treat their pain. I have to treat their problem. I am a problem solver. And if you are not going to a healthcare provider, or if you're not going to a fitness provider, a wellness provider who is solving your problem, why are you going? Because I will tell you, a lot of people who go through the traditional healthcare model, whether they're going to a physician, whether they're going to traditional physical therapy where insurance is paying, guess who's making your decisions? It is not you and the provider. It's the insurance company, because you've been labeled with a code called a diagnosis. And when you're labeled with that code, that tells the insurance what you're allowed to get. That's why I had a patient who had an Achilles tendon repair in a walking boot, and he got denied for physical therapy. Why did he get denied? Because he was functional. Have you heard that phrase before? I'm functional. Well, what does functional mean in the traditional healthcare model? That means you can get out of bed and go to the bathroom. That's just how it is. If you can get up out of bed, go to the bathroom, get back in bed by yourself, you're functional. If you can walk around in your house, you're functional. I remember the exact conversation I had with that insurance company. I said, he lives in a 2-story house. He has a walking boot. He has a wife who is legally blind. He requires the handrail to go up the steps in his walking boot so he doesn't fall down. How is he going to carry his laundry up and down the steps? That is not functional. And the lady said to me, well, he can move around in his house, so that makes him functional. We are going to deny his therapy. And then I posed the question to her, and I said, if this was you, and you had a walking boot, and you required a rail, and you lived by yourself, and you had to go up and down the steps, holding on, so you didn't lose your balance and create another injury, Would you be able to do it? Or would you want more physical therapy? And I got 4 more visits of physical therapy for him. My point in saying all this is, in that model, you are a diagnosis code. You are going to be treated for your pain, and when your pain is down and you can get up and go to the bathroom, or you can raise your arm and dress yourself, you're functional and you're done. But your problem actually isn't solved. I am fired up about this because people don't just come to therapy or seek a fitness professional because they have pain or because they're sore. Most people will live on some level of soreness. I want you to think about that scale, that 0 to 100. 0 to 30 is like a mild issue, very, very mild issue, a low issue. Let's just say 10 is very mild, 20 is mild, and 30 is a low issue. If you have symptoms in those areas, you're not really changing your life too much. It's like, oh yeah, I'm getting older. You know, I have some aches and creaks, and I make noise when I go up and down the steps. But guess what? You still have a problem. Because something's going on that's causing all of that. It just isn't interfering with your day until it does. And it's when it does, and it goes above that 30 to it's somewhat noticeable, or it's definitely noticeable at that 70, and you have to change what you do, or you have to delegate what you do, or you just flat out can't do what you want to do, that is when you seek assistance. That's when you seek an expert. Not because of the pain, and of course you want the pain gone, but you want the problem gone because you don't want it to come back again. And that is what I do. I solve people's problems. So my question again to you is, are you being treated for your pain? Are you being treated for the code that's next to your ID number and your name and your birth date on the form, or are you being treated to solve the problem? And if you can't be definitive in your answer, I want you to reach out to me because I want to solve your problem. I want to get your pain gone because honestly, that's the easy thing. Now, you might be thinking, I've had pain for like 20 years when I go up and down the steps, or I can't move and squat to lift up a laundry basket, or you know, I can't raise up my arm higher than this because when I do, it's painful. I have worked with people who have had pain for 2 to 3 months, and I've worked with people who've had pain for 20 to 30 years. And I will tell you that 95% of the people I work with, I can get their pain down at least 30% in 45 minutes. Now, I don't make any guarantees. If you have a fracture, or a broken bone, if you have a torn muscle, and you are about to have surgery to repair that muscle, that's a different story. But I am talking about muscle strains, ligament sprains, herniated discs, spinal stenosis, all that code language that people are like frightened by when they see all the numbers next to their name. When they look in their My Chart and their medical record and they see, oh my gosh, I have herniated disc. Oh my gosh, I have stenosis. Let me tell you, 100 people could be in a room. All of them can have a herniated disc, but only 50% of them have symptoms. And there's lots of people who have arthritic changes that start in their 20s and they start developing stenosis and they don't have pain. Pain is the easy part of solving the problem because once you get the pain down, you can do amazing things. Now, I am not here to say that I guarantee everything. Like I said, 95% of people who work with me get their pain down by at least 30% in the first 30 to 45 minutes. That's a fact. I can go through chart after chart after chart and point out those numbers. But the real problem isn't the pain. The real problem they're seeing me is because they can't get down on the floor to play with their kids. Or they can't go to the basketball game because the buzzers and the whistles flares up their migraine. Or they're so dizzy they can't drive to their appointment, which is why I do virtual appointments too. Are you being treated for your pain, or are you being treated to solve the problem? Because that's two different types of treatment right there. I'm not diagnosing anybody on this call or on this video here, and I'm not treating anybody on this video. I just want you to think about that question. When you go to your provider, when you go to your fitness professional, when you go to your dietitian or your nutrition specialist, are they solving your problem? Here's a few red flags. Let's wait and see if time and rest will help. If you hear that radar needs to go up. Let's see if rest and time help. Another red flag is, well, let's get you through this acute phase, and then you really need to keep seeing me once or twice a week for maintenance. Okay, why aren't they teaching you how to fix yourself? So that's another red flag. Now, there's a little caveat in there. If people have repetitive stress and strain at their job, or have high impact stress and strain, like professional athletes, the military, law enforcement, or you have a hard physical labor job like construction or loading and unloading on the docks of a manufacturing plant or a warehouse. If you have pain or physical activity demands like that, you may need some maintenance. But you also need the tools to fix yourself. So I encourage you to really think about that question. Are you being treated for pain and your diagnosis code? Or are you being treated in a way that solves your problem so that you can fix your own problem if you have some recurring symptoms? And that leads me to people with chronic pain. People with chronic pain, they get acute flare-ups of their chronic condition. You have rheumatoid arthritis, if you have fibromyalgia, if you have chronic fatigue syndrome, if you have diabetes or high blood pressure, even these type of chronic illnesses, you can have flare-ups. You could eat something and throw your sugars off. You could eat something that's really high in salt and throw your blood pressure off. But do you have the tools to know how to stabilize that blood pressure again? Do you have the tools to know how to bring the sugar levels back down with and without medication? I'm not implying that you should stop taking medication. And if you start to hurt again and you recognize that, ooh, I might have just overstrained myself in the yard doing 4 hours of gardening over the weekend, or that first snowfall and you're shoveling snow for the first time, oh, I think I tweaked my back. Do you know how to fix it without having to go to somebody else? If you don't have answers that say, yes, I can fix myself. Yes, I know how to solve this problem now because somebody taught me how to do it. Yes, I kind of have an acute condition of my chronic condition. I'm having a flare-up right now, but if I do this, this, and this, I know I can get my own symptoms down. If you don't have those answers, reach out to me, please. If you don't have those answers, why? And why not? I'll leave you with this question again. Are you being treated for your pain? Are you being treated for your problem? And do you know how to solve your own problem? Have you been equipped with the tools you need to take control of your own problem and solve it? If you don't, or it's unclear, private message me. Comment in the feed. I want to help you. Thanks a lot. Have a great day.